Well, it is back to school season, and that means new schedules, endless carpools, and homework battles. But for many moms, this time of year brings more than just stress. It can unmask or even worsen symptoms of perimenopause. So here to talk more about that is Dr. Georgine Nanos from the Kind Health Group. Good morning, Dr. Nanos. Good to see you.
Good morning, Lauren. It's great to be here.
So, I remember growing up with my mom, menopause, perimenopause, it was taboo. No one really talked about it. And now we are seeing perimenopause everywhere, affecting women in their 30s and 40s. But tell us a little bit about what exactly this is.
So perimenopause is a time in women's lives where our hormones starts to shift. We have estrogen, progesterone, testosterone hormones in our bodies, and around the mid 40s and 50s and even late 30s, we can start to see major fluctuations in those hormones, and those affect our mood and our sleep and our our whole body. They're more than just reproductive hormones, and they can really unmask a lot of anxiety and irritability, brain fog, sleep disturbances. So you start to feel like you're kind of losing it, and it's not in your head. It's a real physiological and biological condition that's happening in your brain.
And that's the thing. A lot of times it's just chalked up to stress. You're probably a mom of kids. You're not at menopause, but you're starting to notice that you just feel a little overwhelmed more than you ever did. What are some of the red flags where you should be, okay, time to get something checked and see if there's a solution?
Yes, you're absolutely right. It is a condition very frequently dismissed, but it really shouldn't be because it affects so many women in such a profound way. So red flags would be if no amount of sleep is helping you, if your anxiety and brain fog are affecting your work and your home life and really interfering with your ability to function, then it's time to get help.
And what kind of help should you seek? I mean, what type of doctor should you be seeing?
So you want to see licensed professionals. A lot of family doctors, OBGYNs are very well equipped to handle these conditions, and we certainly do so in my practice all the time. The things that you can do in terms of lifestyle modifications would be to really, really prioritize sleep, making sure that you're getting enough sleep, turning off your phones. I know, easier said than done, right? And then also focusing on nutrition and movement, cutting back on sugar, and getting at least 20 to 30 minutes of exercise a day. And then the most important part, I think, also is seeking that medical attention when you can. There are mental health support options, therapy, medications, and then the thing that I always get excited about, as you know, is TMS, Transcranial Magnetic Stimulation, and that helps stabilize these hormones, their connection in our brain. They help stabilize serotonin, and so getting hormone replacement therapy in addition to TMS helps to stabilize both the hormones and the brain-body connection as well. So you get a little bit of both by getting that hormone support, and then TMS is a non-invasive, safe way to regulate our mood using magnetic field energy to kind of restore that neuroplasticity of the brain and really support what's going on with the hormones and that brain-body connection in a very safe way. And so the combination of the two is a very powerful way to help women kind of get their balance back and feel like they're in much better control of their lives. So it's an exciting advancement in medicine.
Yeah, I mean, we can talk a whole nother segment on this, but there's so many, I think, myths to get through when you talk about hormone replacement therapy. I mean, that was it was like a bad term for a long time, but the science behind that has kind of changed.
It is, and it has evolved so much in the last 20, 25 years. There were early studies showing that it was not safe, but going back and looking at those studies now, we've learned that there were a lot of flaws in those early studies, and hormone replacement therapy is something that every woman should discuss with her doctor. It's an individualized decision. Not every woman is necessarily a candidate, but the idea is to be on the lowest possible dose to treat your symptoms for the shortest amount of time. It also helps to stabilize cardiac health. It's really important If you start it at an early enough time before menopause, it can be a cardioprotective method of helping your body as well. So getting those hormones in check. And then we were talking earlier about how when you get your hormones checked, sometimes they look totally normal. And that's very common. Hormones fluctuate all the time, day to day, hour by hour. So checking them on the labs doesn't always tell the whole picture. And so that makes you feel like you're going even crazier, right? Because the hormones are normal. But really, in fact, what's happening is it's more of a symptom-driven condition. And so the hormones don't tell the whole picture on the actual lab sheet.
Yep. There's so much to dive into here, but it's great to be talking about it because it's really not talked about often enough, I think. So thank you, Dr. Nanos. Appreciate it. Kind Health Group obviously can be a resource there for women as well.
Thank you.
Good to see you.
And I'm glad we're talking about it. We're going to talk about it all the time.